Hi, my name is Alexa Stern, and for my individual presentation, I'm going to be talking about some of my research experiences and my future interests in the computational modeling of different airway infections. So I was first introduced to computational modeling, specifically looking at different airway infections in my undergraduate research that I did at Purdue University in the biomedical engineering department. And so what I have on this slide is the poster that I presented at the BMES conference during my senior year of college. And what this goes over is looking at a computational model that we built of Mycobacterium avium infection. And that's an infection that works similarly to tuberculosis and how it infects patients. And what we were really looking at in our model is the difference in the immune response of premenopausal and postmenopausal patients, because there are immune changes that differ when a woman undergoes menopause. And so kind of looking at how that may be a disparity in terms of infection clearance. And so what we really started with was building the basics of the agent-based model. So inputting different parameters for the model in terms of like immunological parameters. Um, and that's shown on the left side of the model. So looking at a couple different rules that we used as well, such as healthy macrophages probabilistically follow chemoattractant gradients produced by bacteria or infected macrophages. And so what that means is that what we were able to code into the model is that macrophages go towards bacteria or infected macrophages when they sense them. To make sure that they're clearing that infection out. And so there's some other rules that we also implemented that I'm not going to go over just because it is pretty in depth. But that was our basic implementation of the model. And we were using an agent-based model. And so what that means is that you assign every particle in your system, whether that be a macrophage, bacteria, um, any other kind of agent that you're looking at in your system, and you put it on a grid and you divide up your time. So we looked over 14 days and you divide up your time into equal segments. And so for ours, we looked at every hour. And you say that with each tick, which is 1 hour of time, you have a probability of each agent moving this far, having this action, and things like that. And so that's how an agent-based model works, is instead of looking at the system as a whole, it's looking at each individual piece in the system. And so we were able to kind of elucidate a lot from the model that we created, but what I really want to focus on is on the right. Um, and you can see the infection clearance in premenopausal and postmenopausal women is starkly different. And so in premenopausal women, there's a lot more infection clearance by day 14 than is in postmenopausal women. And so that's shown by the number of simulations that are black, which means that all the bacteria are cleared by day 14. And so when all the bacteria are cleared, that means that you've been treated for this infection and you don't need to worry about it anymore. And you can see that in the premenopausal women, there's a lot more simulations that reach that clearance than in postmenopausal women. And so one thing that I really focused on when I was doing the model after we built the agent-based model is to evaluate different effective treatments for this. So looking at if we put different antibiotics into the system, how is it going to respond? And so this is a dose response curve that was generated from the data. And so you can see over time, there were different doses that were implemented. It was about every 15 hours. And so you can see that the rate constant for antibiotic killing jumps every about 15 hours in those little spikes. And so what that means is that each time that there's a increase in the amount of antibiotic introduced to the system, so each time that there's a new dose, there's an increase in the rate constant of antibiotic killing, which means that the antibiotics are better able to clear the bacteria. And so translating that into my graduate research interests, I've been working on so far, and what I'd like to continue working on is using a machine learning model to evaluate the diffusion of nanoparticles. And so two of these programs that we use are motion network and multiple particle tracking. And so what multiple particle tracking gives you is a MSD value, so mean squared distance that a particle travels. And Motion Network is able to take that MSD and calculate the kind of diffusion, whether that's Brownian motion, fractional Brownian motion, or controlled continuous time random walk. And then say over this period of time, how much of the nanoparticle is going to be able to diffuse through this surface, and how much of it is going to get stuck. And so specifically, I want to use those to look at diffusion of nanoparticles through a PEG hydrogel, which could create a platform for extended release of drug delivery platforms. And so, really combining my experimental research with the computational research that I kind of discussed at the beginning to do a little bit more with drug delivery. Thank you.